As we prepare to take our T-scan measurements, our force measurements with our patients, we'll need to prepare our handle and our sensors for the taking of the scan. The T-scan Novus handle will accept 3 different sizes of sensor supports, which will then hold our sensors in a level position on the occlusal plane as we're taking our scan. These Novus sensor supports easily slide into place on the outside of the Novus handle and will remain there securely during the taking of the scan. These supports come in 3 sizes, and the 3 sizes are small, large, and universal. The large size is not a name that we would normally use with our patients, so in our practice we generally refer to these as the regular size because we almost always use the large or regular sensor for all of our scans. The only time we use our small sensor or our small sensor support is if we have an extremely small patient or a patient who's had 4 premolars extracted or a small patient who's in primary or mixed dentition. So we're going to set these aside for a moment and think about the universal support. The universal support slides onto the handle, and it will accept either a small or large sensor. And as we slide that sensor into the handle, we must of course separate that and make sure we only have 1 instead of 2. And that this will slide all the way into this support until the point of the support goes into the gray sensor zone of the sensor itself. Once it's in place, we will latch the sensor in position from behind, and this is now secure and ready for scanning. I also always will squeeze that a little bit and make sure that on the screen I'm seeing communication between my handle and my screen. This universal support comes in handy for a lot of patients. However, it doesn't lend very much support to the sensor itself, which is sort of floppy and will be hard to position in the patient's mouth. So usually, unless necessary, we will use the large or the small sensor support whenever we can. I'd like to visit with you briefly about the design of the sensor supports. The large and small sensor supports both are fairly U-shaped, and for those of you that regularly take impressions on patients, you'll know that if your impression tray was shaped like this, like an old Rimlock tray or something like that, that this would be too narrow in the posterior to capture your molars. This is true of these supports, and while they are useful on many patients, we often find that this is too constricted in the molar region. Therefore, what we do is we will adjust or change our sensors to be smaller than the supports that come with the normal scan, and we will shorten them to be in between the large size and the universal. This in between or adjusted sensor support size is made simply by taking your large support and taking it with a handpiece or to the laboratory and removing the end of this where it tends to go back straight in the posterior. It means we will normally leave about 1 centimeter, 10 to 15 millimeters of slot for the support, which will give us more support for the sensor itself than the universal would, but maybe just a little less support than the full. We have found in our practice that we can take almost all of our scans with the large, adjusted, shortened sensor support with the large sensor. So in our practice, we will shorten both the small and the large supports to be more than the universal, but a little bit less than the original. This support, once again, goes onto the handle. This is the large, it has an L on the top here. This is the large or regular support. This is the large sensor. It says up here and large here, so it's easy to orient. We're going to slide that into the support. Make sure the point of the support is into the gray sensor zone. We'll latch that from behind and double check on screen to make sure that our sensor is reading, and we're now ready to start taking scans on our patient.